Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about the three most common genetic screening tools that are used during pregnancy. Now, this is basically just a continuation or at least more information on the NT video that I just did. So, check that out if you want to know about my own personal experience about having two abnormal nuchal translucency scans. But basically, in pregnancy, we are using these screening tools just to give a risk factor as to whether or not baby has a chromosomal abnormality. I say genetic risk basically because this is not a definitive answer as to baby having a genetic abnormality or not. The only way that we can know this is if we get a more invasive test done, such as an amniocentesis or a CBS. These two tests are going to actually look at baby's DNA, and that is how they are going to definitively tell whether or not there is some sort of abnormality going on. But with these screening tools that we are going to talk about during this video, it is basically just a tool to see if your risk is elevated or not for baby to have something chromosomally abnormal present. Now, the first one that I'm going to talk about is NIPT screening, which stands for non invasive prenatal testing. This is something that I'm sure many of you have heard about before, and this is a blood test only, and it goes under different trade names such as the Harmony test or the Panorama, I think is another popular one. But essentially, this is a test that is going to screen for a couple of things, including the three most common trisomies. They're also going to screen for triploidy, microdeletions, as well as the Rh positive or negative factor, which for those of you that don't know, if you have an Rh negative type of blood, then you are going to need basically a Rh blocker to make sure that your body doesn't attack baby during pregnancy if the blood type is not the same as yours. You can also find out gender with the NIPT testing, which is kind of cool because you do this at around 12 weeks' time. Sometimes even a bit earlier, you can get that NIPT testing done, and you can know gender too. With the NIPT testing, then it does have a pretty high detection rate. I think it's over 99%. So if baby has any sort of these conditions that the test is going to be looking for, it can detect over 99% of cases that are positive. There's also a low false positive rate of, I think, less than 0.1%, I want to say, which is really, really actually important because a false positive means that the test tells you there is a genetic abnormality when there is not. And we always want that to be as low as possible just to make sure that we are not worrying patients when there is nothing to worry about. The second test is going to be the Nuchal Translucency Scan. So this is the one that for myself personally, I had two abnormal nuchal translucency scans. And this is the one where we are going to be looking at the fluid at the back of baby's neck. And we are also going to be doing a blood test same day. That blood test is going to be looking at two factors in mom's blood. It's going to be looking at the PAP-A that is present, as well as the level of HCG. The levels of these two things indicate whether or not there is a higher risk for trisomies. And also, we do look at the genetic background of mom as well, and basically just her prior risk factors. And those three things combined are going to give a risk of whether or not baby has a chromosomal abnormality going on. The bonus with this one, so the NT scan over the other two, which are blood test only, is the fact that we actually see baby on the screen with ultrasound during the scan. So if there are any sort of major structural abnormalities going on, this will be detected obviously at around that 12-week time when we are doing the NT scan. And if these abnormalities are not due to chromosomal abnormalities and they are just structural only, then obviously we can detect it sooner than if, let's say, the patient just had a blood test only for genetic screening and it came back normal, but there's something structural going on. Then we would not actually find that out until the anatomy scan, which is between 18 to 22 weeks. So there's the bonus in that, which is obviously really nice. The NT scan is mostly for checking trisomies, and the biggest one that we think of is trisomy 21, simply because that one is the most common. And with the NT scan, then it does have a 85 to 90% detection rate. So obviously lower than what the NIPT scan has. And there is a higher false positive rate though. So there is a 5% false positive rate, which means in 5% of cases that this nuchal scan says, yes, there is an increased genetic abnormality, that's actually not the case. And lastly, let's talk about the quad screen. So this is a blood test only screen, and it is done between 15 to 21 weeks. And this is what we offer patients if the NT scan doesn't end up working out. As in, if baby is not cooperative for us to be able to get that fluid at the back of the neck, then basically we just go ahead and offer the quad screen, because after about 14-ish weeks, then the measurement of the NT at the back of baby's neck isn't going to be valid anymore, and therefore they can move on to the quad screen if they would like. So again, this is done between 15 to 21 weeks. It is a blood test only, and with this blood test, they are looking at 4 different proteins in mom's blood. This is mostly just to check for trisomy 21, trisomy 18, as well as any sort of neural tube defects, and it does have a bit of a lower sensitivity or a lower detection rate than the other two. It's only at about 80-ish%. So essentially, any babies that have any of those genetic abnormalities that the screen is looking for, it'll detect about 80% of cases. But it does have about the same false positive rate as the NT scan, which is about 5%. I also forgot to mention that with the NT scan, anything over 3 millimeters for the thickness at the back of the baby's neck for the fluid is considered abnormal. But this does not mean that baby will have something for sure wrong with it, nor does it mean with any of the other tools as well that we use for screening that baby has something wrong with it just because the risk comes back higher or elevated. These are simply just tools that we use in order for us to see if mom's risk is elevated for having any of the genetic abnormalities that obviously the tests are screening for. If the risk comes back elevated, then the patient will be offered further genetic screening via Amnio or CVS, like I mentioned in the beginning of the video. And the Amnio and the CVS are invasive testing procedures. So unlike the NIPT, which again is non-invasive prenatal testing, or the Nuchal, or with the quad screen, this is going to be more invasive. And I mean this in the way of they're actually going in to get the amniotic fluid. So basically, they either put a needle in through mom's belly with the amnio, or they put a needle in through the cervix for the CVS, and then they are able to get fetal DNA that way. With the genetic screening tools, there really isn't a risk for miscarriage when you are doing those screenings. But with the CVS and the Amnio, there is, I believe, about a 1% or less than 1% now, I think, with the advancements that we've made. And especially if you've had someone who is very experienced in doing the CVS or Amnio. But either way, there is still a risk of miscarriage with these procedures, just because we are actually going in and we are disrupting the amniotic sac. So this is why the Amnio and the CVS are not offered to everyone, while the genetic screening tools, because they are non-invasive, those are able to be offered to everybody. So hopefully this video has been helpful in just summarizing the 3 most common genetic screening tools that we use during pregnancy. And like with anything in your pregnancy, if you do not want to have these genetic screening tools, then absolutely you do not need to go ahead and opt into them. They might be strongly suggested if you do have a history of having genetic abnormalities, either with previous pregnancies or in your family. But just remember, it is absolutely up to you whether or not you want that done. And even if they come back as having a higher risk for having a genetic abnormality with baby, that is not going to be the case guaranteed anyways. You would have to go ahead and get that Amnio or the CVS to determine if that is the case for sure. But even if the risk comes back really high with these screening exams, I've definitely had it where the pregnancies then end up normal, like mine. So again, hopefully this has been helpful and it's cleared up a couple of things. Like always, if you guys have found this video helpful, please go ahead and like and comment and subscribe. And if you have any suggestions for future videos that you would like to see, definitely leave them down in the comments below. And also check me out on TikTok. I make videos over there as well.